With our focus on safety and occupational health, we do all we can to avoid injury at work. Once a work-related injury does occur, what you do as the employer can make a significant difference in the outcome of the case. Let's take a closer look at case management for work-related injuries when we come right back.
Welcome to this episode of Workplace Health, Improving Employee Health and Productivity, with President of Workplace Health, Inc., Shanna Dunbar.
Case management plays an important role in the treatment and rehabilitation of a worker following a work-related incident. A qualified case manager is usually a registered nurse with special training in occupational health. He or she will coordinate all aspects of the care. The statistics show that with proper case management, the injured worker gets better, faster, and back to work, keeping the cost to a minimum on the claim. For example, finding the right provider for the type of injury. Referring to a specialist if the primary provider is not getting the results in a timely manner. You might think that this adds to the cost of the claim, but actually you keep the cost down by providing the right kind of treatment as quickly as possible. Case management can be telephonic, making phone calls to the healthcare providers, injured worker, and coordinating with the employer, or in the field. Nurses can actually meet an injured worker at the doctor's appointments and talk to the doctor about the care and the return to work plan. We can really see what is going on with the worker and barriers there are to the successful rehabilitation and release to work. As they say, a picture is worth 1,000 words. Most often, these services can be billed to the workers' compensation claim, meaning the employer does not need to pay out of pocket for these services. Nurse case managers will ensure proper utilization of services. We want to always start with the most conservative treatment. If someone hurts their knee and some physical therapy and ice packs can help the pain and swelling, we will start with this first before we consider arthroscopic surgery, which comes with more risks. As we manage a work-related injury, we want to promote wellness and autonomy through advocacy. Of course, we can call a provider and make an appointment for the injured worker, but better is to teach them how to navigate the healthcare system on their own. Then the injured worker will take ownership of their care and situation. We want to help them be autonomous and act as a guide rather than just doing things for them. Their job is to get better as quickly as possible, so they need to take an active role in their care. And this leads to my last point. A good case manager will coach an employee toward taking more personal responsibility. No one can get someone else better. Our bodies heal themselves. Now, we can help this with treatment and medications, but it is the individual who needs to do the work to get better and to get back to work. We need to consider the healthcare providers and the treatment that are being offered and the medicines that are suggested as tools in the rehabilitation process. Remember, we do what we can in the workplace to avoid an injury, but once it occurs, returning that employee to gainful employment needs to be the top priority. We're happy to discuss ways to find great nurse case managers to assist you with your workers' compensation claims, so please give us a call. Now go and make it a great day.
Thank you for watching Workplace Health. For more great information, visit www.workplacehealthinc.com. Also browse the other shows found right here at Northeast Ohio Biz TV Shows.